live and making your life's vision a reality. Every Sunday morning at 7 a.m. on the Talk of Chicago, 1690 a.m. WVON.
It's the University of Chicago's Community Health Focus Hour. Hashtag Doctor on Call on Chicago's Essential Storyteller, WVON.
I'm your host, Dr. Ed McDonald. You know our motto: we keep it real, we keep it honest, and we keep it thorough. So today we have an amazing show planned for you all. We're going to be talking about dental care, oral care, and some of the upcoming initiatives at the University of Chicago. I have some excellent guests here. We have a friend, a colleague, a mentor, a leader at our institution, Dr. David Meltzer. So he's a chief of the section of hospital medicine. He's also the director for the Center of Health and Social Sciences. He is associate dean for translational research. He is just an amazing faculty member, and I'm honored to have him on as a guest. Is this your first time on the show?
It is not. I think I was on about 5 years ago. I think it was during the pandemic. I remember talking to you all from my bedroom.
Well, welcome back. It's always good to have a return guest. Now, we also have Copal Mather. She is the director of the program for oral health at the University of Chicago. Now, is this your first time on the show?
Yes, absolutely.
Okay. So we have a first-time guest. Chicago, please call in 773-591-1690. And I want you to welcome our first-time guest with some questions, okay? So let's get into it. So let's talk about oral health, okay? Why should everyone be concerned about oral health? Does this have kind of a broader impact on the body as a whole, or is oral health only important when it comes to the mouth and the teeth? Are there other implications for other body parts?
Oh yeah, I'm happy to take this one.
Okay.
So obviously, taking care of your teeth is important for your teeth. It's important for your smile, how things look, things like that. But that just is barely scratching the surface of the connections. Oral health is just integral to health in general, and there are a bunch of reasons. So let me sort of focus on some of the big ones.
Okay.
One is that if your teeth and gums get infected and there are bacteria in there, they break loose and they go to your heart valves and they can go into your bloodstream and you can get really sick and die. And it's not common, but it happens. My grandfather actually passed away due to valvular heart disease, probably because he didn't have the money growing up to take care of his teeth. So it unfortunately still happens, but that's just the beginning of the things that can happen. One of the things that happens is when you get irritation in your tissues anywhere in the body, including in the mouth, your blood sugar tends to go up. Anyone with diabetes can tell you that.
Yeah.
People don't realize it, but irritating your gums is the same thing. It raises your blood sugar.
Yeah.
So it can make diabetes worse, and that causes all sorts of problems. In general, having those irritated gums and mouth causes inflammation.
Yeah.
That can increase your risk for strokes, for heart attacks, for dementia. And then there are all these sort of secondary effects. If your teeth aren't feeling good, you may not eat as well. You may eat foods that are highly processed or even liquids, and those make diabetes worse.
Yeah, I see that all the time.
So, and then there are mental health effects that some of them are social, but some of them may even be inflammation. So I think we could spend the whole hour talking about why the mouth is actually part of the body.
Yeah.
But unfortunately, we don't treat it that way most of the time. We neglect it.
And in all honesty, in medical school, I mean, do you think we as physicians actually learn about the mouth?
Well, not as much as we should probably. There's a long-standing separation, unfortunately, between what we think of as medicine and dentistry.
Yeah.
Right. And I think both dentists teach about medicine and medicine teach about dentistry, but not enough.
Yeah, I agree. And if you're out there listening, so my dad is a dentist.
Oh my gosh, I had no idea.
Yeah, he would be very excited about the show. My brother is also a dentist, so they both would be excited.
Cool.
So what are some common oral health issues that adults face? Are we talking about gingivitis? What are some of these things that the average person might be dealing with and ignoring, for that matter?
I know that's the biggest thing, right? With adults ignoring oral diseases, it's easy to ignore because sometimes they're mild, sometimes they're intermittent, it could be sporadic. So thinking about as simple as bleeding, right? Like when you're brushing, there's bleeding in gums, it's easy to ignore, but those are some of the common things. Pain, right? Toothache, sensitivity, think about it. Like sometimes you eat something hot, something cold. All of them have different impact on what's happening, what's the underlying cause for those. But it's, I think, very easy to ignore some of those things especially when there's so much going on in the rest of your body. You ignore it, which is where we come in, which is where dentists come in. And it's important to go for regular checkups, getting them checked regularly, and not waiting for them to advance, right? Like not really waiting for them to become acute conditions where you need complex procedures and things like that. So I think those are the things that are really important to think about and keep an eye out for.
Okay. Now, you just mentioned regular checkups. For our listeners, how often is regular? Does that mean twice a year, once a year, or is there some variation?
We recommend twice a year, every 6 months at least, going to a dentist, having an ongoing dental home where you can go if you have issues, but at least once in 6 months is what we think is important in having a dentist you can go to if there's something else going on.
Okay. And besides going to the dentist, what are some other basic things that people can do at home to kind of maintain their oral health?
Regular brushing twice a day as soon as you wake up in the morning before going to bed. I think that's minimum. Flossing, that's something that's routinely forgotten, like flossing, which is really between your teeth, and what gets stuck, what you don't see between your teeth is flossing. That's another important big one that we talk all the time about. And as David talked about, its connections with heart disease and associations with bacteria that is in between your teeth and going to other parts of the body. I think that's another big one, in addition to regular dental checkups.
Awesome. So
then the one other thing I guess I would add also, of course, is diet. Right. The more sugary foods you're eating and drinking and putting in your mouth, the more fuel there is for those bacteria to grow. So making sure that you minimize that, particularly important for kids, but important for all of us.
I've seen kids fall asleep with like bottles and the sippy cups and everything. Not good for oral health in general.
No, apple juice is probably not the friend of the little ones.
Tell me about it. And I'm glad you brought up the bacteria in the gut. So, I mean, in the mouth. What role do they play in all of this?
Oh, it's really important. So you have bacteria throughout your body. There are certainly bacteria in your mouth, and there are bacteria also in your stomach. And the bacteria in your mouth are connected to the bacteria in your stomach, because every time you swallow, it's going in there. So when you get a disturbance of the bacteria in your mouth, you're more likely to have a disturbance of the bacteria in your stomach as well. And that turns out to be, and by stomach, I mean stomach and intestines and all the way through. And that's really important, because that set of bacteria regulates how you digest food, and it affects things like how your blood sugar moves and so on. And it affects the degree of inflammation. So we're doing a lot of research at the University of Chicago trying to understand how the microbiome, those bacteria in your gut and in your mouth, affect things like diabetes and inflammation and, other risks of adverse health problems. But I think most people believe that the mouth is a really important part of it. One interesting study I heard about recently was that people who use antibacterial mouthwashes actually are more likely to have high blood pressure. Pretty interesting stuff, right?
I saw that. I saw a similar study that looked at people who use mouthwashes 3 times a day have a higher likelihood of diabetes.
Okay, I believe it. Right. So it's again, it's just showing you that like having this healthy environment in your mouth is a good thing for you.
So what are some type of things that we should do to have this healthy environment in the mouth? Does it mean, so obviously avoiding a lot of sugar is one thing, brushing your teeth. Are there anything else? I mean, I've seen on the market, there are some like oral probiotics or prebiotics. Is that a thing or not a thing, or is it too early to say?
I don't feel I know the answer to that. I know there are studies out there. I think there's some disagreement about what works and what doesn't. It's an active area of research. I don't feel I have a definitive answer. Hopeful maybe you do.
Yeah, we're really starting to now talk about these things, which is important and interesting, and which makes it like we're talking about it here, and everybody, I think that's important. Don't know definite answers, and studies and research, we're doing a part of our contribution, but there's a lot more that can be done, and that a lot more can be studied on the topic.
Okay. And for our listeners, I mean, even with mouthwash, is there any rationale for avoiding a mouthwash that has alcohol, or should we, focus on? Is there a specific brand or type of mouthwash that's better than one or another, or maybe the literature just doesn't answer that question?
Here's what I understand. The FDA continues to allow alcohol-based mouthwashes on the market, and there are people who use them, and alcohol is legal too.
Yeah.
But there are known risks between oral cancer and alcohol consumption, right? That's pretty clear there. The size of them you can debate about, whether they're causal, maybe you can debate about it, but I think, there's some credible reason to believe that alcohol has some risks.
Yeah.
I do know that people who have had head and neck cancers in particular are, really discouraged from using alcohol. So it's something I personally don't use. So I don't use alcohol-based mouthwashes at all.
Yeah.
I also have a little bit of a family history of things like that. So I'm careful. But there are non-alcohol-based ones. Now, it's not clear to me that the non-alcohol-based ones don't also have some risks related to disturbing the mouth.
Yeah.
I think these are areas where more studies probably are important.
I agree. And similar to you, I also avoid alcohol-based mouthwashes. As a gastroenterologist who focuses on nutrition, I have treated a lot of patients with head and neck cancer, and we know that alcohol is a risk factor for head and neck cancer. Whether or not the amount of alcohol in mouthwash is a risk factor, hard to really say. I mean, there are some studies out there, but for me personally, that's one simple thing I can avoid to some degree.
Yeah, there's a substitute.
Exactly. So what do you say to patients who maybe have some, bleeding gums, but it doesn't hurt? Their mouth feels fine. Like, is that anything that they should worry about?
Absolutely. I think there is something going on. That's why there's bleeding. It could be irritation. It could be some underlying infection.
Mm-hmm.
Something is going on where there's bleeding. We know that from the body.
Mm-hmm.
So I think just going to your dentist, having a dental appointment with a dental hygienist, a dentist, whoever, right? I think identifying what's the cause and what's happening. That's why routine checkups are important, is what we say. It might not bother you at the time, but it can lead to something more serious, and that's why it's important to keep an eye out on what's going on. It might start with mild gingivitis, but it could lead to further bleeding, bone loss, and things like that. That could happen, severe periodontal disease. So I think those are things to keep an eye out for.
Yeah, so sometimes people talk about receding gums.
Yeah.
So that's as periodontal, as gingivitis progresses into periodontal disease. First, the gums start to go back, then the bone starts to go back, then the teeth start to get loose, then you start losing teeth, and so on.
Gotcha. And with gingivitis, what do you mean by gingivitis, just for our listeners?
I think that's just when your gum, it starts with your gum and the mild inflammation that starts in your gum. And when it goes further down into your bones and further down into your periodontium, which is the deeper parts of your gums, that's when it converts into periodontitis. But the surface level that you see is gingivitis, and like change in color of your gums, bleeding gums, change in texture, surface texture, and things like that.
Okay. And with gingivitis, can this lead to tooth loss?
Yeah. Loose teeth. Yeah, exactly. Because if you don't care about it, as David mentioned, there's receding gum line, which how they connected to the bone, and the tooth is connected to the bone, and then you start losing that, and that's when tooth loss happens. So it starts impacting your bone, and the teeth start becoming loose.
Okay. Now, does age play a role? I know oftentimes people think that just as we age, people just end up with dentures. Is that a thing, or is that just a reflection of not taking care of your mouth as opposed to age?
Well, I do think that, once you lose teeth, they don't grow back, right? Except you're a kid. So in that sense, it is related to age, but it's not inevitable that everyone lose their teeth.
Gotcha.
Right. There are lots of people who live to very advanced stages and do really well with their teeth.
Yeah.
And, the trick with all things in your body is try to make whatever thing you're trying to take care of, last a little longer than the other things. Right.
Tell me
And
about
so
it.
age is clearly a risk factor for worse outcomes, but it's not inevitable that we lose our teeth.
Okay. Okay. So listeners, please call in 773-591-1690. Let's shift gears a little bit. So we are going to be talking about a mobile dental unit and no cost care study. Okay. So one, I think going to the dentist, it costs a lot of money to some degree, especially if you don't have dental insurance. And unfortunately, we live in a society where for reasons I don't quite understand, we separate dental insurance from like regular health insurance, even though it all should be kind of covered by health insurance to some degree, at least in my humble opinion. With this mobile dental unit and no cost care study, maybe can you help educate our listeners about what the overall plan is?
Yeah. I can tell you a little bit also about like how we got involved in this. And you've known for many years and helped us out tremendously with our comprehensive care study, where we have opportunity for patients who've been hospitalized to have the same doctor caring for them in and out of the hospital. And because we had that comprehensive care study a number of years ago, we got a call from folks at the George Richmond Foundation who support dental related research. And they called us up and said, hey, we saw you have a comprehensive care program. Does comprehensive care include dentistry?
Yeah.
And I said, oh, I wish it did, because I take care of a lot of patients at UFC in primary care and in the hospital. And I've seen what the needs are for people.
Yeah.
So we got to know each other. We started doing some studies first of oral health in hospitalized patients. And over time, we learned that they were really interested in studying whether giving people better access to routine dental care would really improve not just their oral health, but also their systemic health. So once we got to know each other, we were talking about designing a study to do that. And so starting a little more than 5 years ago, we started a randomized trial at the U of C to understand whether giving people access to free dental care would improve their oral health and systemic health. And so we've been doing that study for about 5 years now, and we've wanted to continue to grow the study and involve more people in it. And one of the barriers we realized to getting more people involved in the study was just the geography of our clinic being located in Hyde Park.
Yeah.
And UFC has an increasing number of clinics out in the south suburbs. We wanted to get closer to those people as well. But in addition, we also know that there are a lot of patients for whom even just getting out of their building or their house is hard.
Yeah.
Right. And so we figured with a mobile van, we could bring the clinic closer to people and give more access to people in order to be able to really benefit from the study and help the study go faster so we get answers sooner.
Nice. Now, what type of services can you provide with this mobile van? I mean, is it similar to what you can get in a dental office?
Yes, we have everything that we do in our office in Hyde Park. We have all of those. Our dental van is equipped. It has 2 dental chairs. It has X-ray equipment in there.
Wow.
It has a wheelchair lift for accessibility. It has a small bathroom as well in there for patients that we treat. And it from dental checkups, X-rays, regular cleanings to even deep cleanings.
Wow.
Extractions, simple extractions, the root canals for front teeth, dentures, partial, removable partial and full dentures as well. So we're providing all services that we provide in our Hyde Park clinic in the mobile unit, and that's how we designed it.
That's amazing. I think that's a huge offering for our community.
It's such a satisfying project to be able to do, because I think it's really helping people.
Yeah.
Very directly, which is great. And we know there's so much need out there, but also because it's answering a question, that we really need to answer, not just to be able to help the folks here, but eventually to be able to provide the data that helps decision makers decide to make investments in giving more people access.
Yeah. Is that the overall goal of the study?
Yeah, the overall goal is to understand this relationship between oral and systemic health, and in particular, whether offering people access to no-fee dental care can improve those outcomes. And we hope that that information will inform wise decisions about public policies and investment.
Okay. Now, Copal, before we get into more detail about the mobile dental unit, we always like to hear someone's origin story in terms of how did you get involved with this field specifically? So dentistry, what led you down the path to becoming a dentist?
So I practiced dentistry in India. So I grew up in India. My mom was a doctor. My mom is a gynecologist, and I knew I had a calling for healthcare. And that's when I was always around my mom when it came to healthcare, and then realized I wanted to do something. And then dentistry happened, and I just loved the field so much. I practiced for a little bit in India, only to realize there was more to it. There was more research and more things to do in it. And I reached out to David. I think I was back in India when I first found out about this program in oral health at UFC, and reached out to David about it, and have just been here for 9 years now, working and growing these programs. And we started, like David said, we started with smaller research projects, and it's been so meaningful to see its impact in the community and see the work we're doing is really making a difference in people's lives, and how the connections with oral and systemic health. I think it's just everything has come together from my background and working and what I'm doing right now. So it's been a highlight.
That's amazing. I mean, it sounds like you've had an amazing journey.
Thank you.
So in India, were you practicing in an urban setting or a rural setting or some combination?
I was more in the urban setting, and I was just started initially in my career out of college and was practicing, and early enough realized that I wanted to do more, not just practice, but do more in the research side. So yeah.
Okay.
Yeah, one of the great things about doing this with Copal has been she's been such a sort of entrepreneur and helping bring us new programs. One of the ones I'm most excited about is we just got a grant from the National Institutes of Health for a training program that allows young folks, sort of college age students, to get involved in the study, helping to recruit and work in a dental environment. And a lot of those are folks who grew up on the South Side and are interested in careers in dentistry. And we're able, thanks to the work Copal has done, to sort of help them get started on their path. And actually, we've got a few graduates of similar sorts of experiences who are now like well through dentistry. Actually, I think one who's finished dentistry.
Yeah. Wow. Few in clinics, in dental schools actively as we speak. So yeah, it's been rewarding.
That's amazing. It sounds like one of the programs I run for high school and college students in gastroenterology.
Absolutely. Absolutely.
I may even have some of my students come by and visit you all.
Send them over.
Okay. Sounds great. So our listeners may have heard terms like tartar. Can you explain what that is? Is that something that we should be aware of? You see the commercials, for Colgate and Crest and all the toothpaste, and they say tartar control. When they say tartar, like what is that?
Yeah, that's just all the food that gets accumulated or anything you're eating and drinking. And if you're not brushing properly, and that slowly starts accumulating in between your teeth or hard to read surfaces, you usually see the front teeth, and you can clean those. The surface areas that you see, it's easier to clean those, but there is tartar which starts growing bacteria and becomes like a petri dish, almost like for bacteria. So that's what tartar is, and it's all the plaque and tartar that gets accumulated as if it's not cleaned well in between your teeth and behind, and sometimes this parts of teeth that you don't see, and it starts going inside your gums. And so yeah, that's why you see all the commercials talking about it, because it has larger impact.
And is this what you clean when you're you mentioned doing a deep clean?
So it depends on how extensive it is. If more for regular cleanings, they can get it more from the surface level. So that's the regular cleaning that you get done when it's surface level and it's easy to reach areas. But when it goes further down, deep inside your gums, and like I said, deeper into your pockets that create between your tooth and your gums, there are pockets that start building up, and that's when you need deep cleaning, which is scaling and root planing. And
gotcha.
Yeah.
And then tartar, is it the same as dental plaques? Maybe they've heard of like plaque
Yeah,
also.
yeah.
So listeners, please call in 773-591-1690. I want to hear from folks who are scared to go to the dentist. If you're scared to go to the dentist, give us a call, because there's a stereotype that a lot of people are scared of the dentist. Is this something that you've encountered with this mobile unit?
I mean, I've encountered it personally. I like my dentist a lot, but I don't particularly like going to my dentist.
Yeah, my dad was my dentist.
Oh, I bet that's even worse.
We have a complicated relationship.
Okay, I think there's a Willy Wonka movie about that. But anyway, it can be a little scary. Sometimes it can hurt. It can be uncomfortable, and I feel I'm lucky with a good dentist and good dental hygienists. And, we've all had experiences of discomfort, but, the way I think about it is I need to do this. This is important for my health. And I'd rather have a small thing that's a little uncomfortable than a big thing that's, more uncomfortable and bad for my health.
Tell me about it.
But a lot matters about the relationship. And I'm a big believer that in healthcare, having a meaningful relationship with the people caring for you really matters. And, I think we have a great team of dentists and dental hygienists who are caring and understanding. And, we try to do the same thing in our comprehensive care program with a primary care doctor, and someone who can see you in the hospital. And, be aware of the experiences people have. I mean, we know that not everyone always has a great experience at the dentist, and some people probably have had worse experiences than others.
Yeah.
And, we certainly do recognize that. And when people come in, we definitely have had patients who are afraid. Copal, you probably want to talk about some of the experiences in the clinic.
Yeah, absolutely. We've had patients who might not have seen dentists all their life, or even like for many years, just because the fear of dentists, not knowing. Sometimes it's just the unknown as well. And I think our team has been they understand that, and that's what we really focus when they come in for the first appointment, and things like building that relationship, building that rapport with the first time we meet with the patient. I think we really emphasize on that, and building that trust is important to our team. And we see that. And really, sometimes it's the complex procedures, as David said, which can be more. And then we talk to the patient, explain what's going on. I think oral education is really a big part of it, explaining to what's going on, what's going to happen in your procedure today, and then talking through it has made a lot of difference. Of explaining what's happening has been helpful to our patients as well. So we see that, but we understand that as well. I think I'd say that, and which helps a lot in making sure patients follow through their treatment recommendations and follow through their treatment plan as discussed with them, and having that conversation has been important.
Gotcha.
I mean, one other part of fear too is actually the money.
Yeah.
You go in and they all of a sudden, are telling you you've got this really expensive thing, and, then you feel like, well, you got to do it, but where's that money going to come from?
Yeah.
And, that's certainly a problem if you don't have dental insurance, but unfortunately, it's also a problem if you do.
Yeah.
Because a lot of things can get really expensive. A lot of plans have co-payments or deductibles, and that's money that people may not have.
Yeah.
And so, it's the fear of pain and, all of that, but it's also the fear of the economic stuff.
It can get expensive. I just found out I have to get one of my kids braces. And I mean, braces, we're paying for a small car.
Yeah.
But it's a lot of money at the end of the day.
It is.
Now, speaking of money, like, who qualifies for the mobile dental health unit? Is this something that's open to the community? Do you have to have insurance? Is this completely free care? Can children come in? What are some of the target demographics that you're looking for?
For a current program that we are running at Hyde Park and the University of Chicago as part of the dental care research study that's happening, it's for people who are 50 years and older.
Okay.
That's one of our eligibility criteria. They should have an ongoing care at the University of Chicago. It could be specialist care if you're 65 and older, primary care if you're 50 and older. So having some sort of care at the University of Chicago, medical care at the University of Chicago. They shouldn't have any sort of dental coverage, either through Medicare Advantage, Medicaid. Illinois Medicaid does cover some dental as well, as what we've learned, even though there are different plans within Medicaid. But no dental insurance is another thing. But if you're not being eligible for Medicaid or being enrolled in Medicaid is also another criteria.
Okay.
But yeah, we really want people to reach out, and we are happy to talk to them and figure out if they're eligible or not. We really don't want people to self-exclude them at this point. If they can reach out to us, we can help them qualify. We even help support patients if they might not be eligible for our program, but we really care about oral health. We really care about the oral and systemic health connection. So we might have some resources to help with where you can go with the kind of insurance you have and things like that. So we share all of that information as well with them.
That's great. So we have a caller. Mike, are you there? Thanks for calling in, Mike.
Yes, I want to thank you for having this program, because you guys are in my interest, and I already heard a little bit of one of the questions I was going to ask about how do you get started, or what's the telephone number to call, or place to go, or email or text. But my questions and information I want to just pass on generally to you.
Okay.
My background is I went to school for dental technology, became a dental technician and so on. Worked in the field for a while. But my exposure to to the dental field, the most profound thing I come to learn is after all of that, I was watching a documentary about dentistry and the dental field. And to find out, and I think this needs to be propagated to all people, all human beings, because it goes along with the health and the care of the rest of your body, which I am a promoter of health, which is every tooth in your body that you're born with and have afterwards that's yours, have its own natural environment.
Okay.
Microbiome environment.
The microbiome.
Like your gut has the microbiome environment.
Yep.
Each tooth in your body has this microbiome environment. And the amazing aspect about it, they're different. Now, man, if they ain't a creator, I don't know what there is.
The microbiome is really fascinating.
Yeah. And it affects your whole body, your life, and your way of being.
Yeah.
And when you start understanding that and learning that you need to, your digestion starts in the mouth. So you need to start working on the mouth to deal with the stomach and the rest of the body and all the other type of things that's going on. So, hey, we need to get with it.
You know what? You sound like my dad as a dentist. He looks at me as a stomach doctor, gastroenterologist, as being a poorly trained dentist. Since I
would have to say all people and medical folks are poorly focused and trained, because when you get a pain in your toe, it affects the rest of your body.
That it
when
does.
You get a pain anywhere in your body, it affects everything. So come on, let's get with it, and the solution, the answer to all of this stuff, as well as in the other aspects of the environment, is the body is a sense of community.
Yeah.
We need to develop more, and I appreciate and think it's wonderful things that you guys are doing about developing this harmonious health sense of community. Recognize it, it's all connected.
Well, we appreciate you, Mike. Thanks for calling in and sharing your insight. I feel like you have a lot of knowledge to share. Maybe one of these days we can bring you back as a guest. We have another caller on the line. Arjun, are you there? Hello. Can you hear me right now?
Yeah.
Oh, there you go. I hear you a little bit. Thanks for calling.
Hello, I'm Kopo Mather's daughter, Eva. I'm Kopo Mather's daughter, Eva. We're so proud of you, Mommy.
Oh, that's a sweet call. I love that.
That is a sweet call.
Thank you for calling.
Thank
That's
you.
amazing. So that's your daughter. She sounds very sweet.
Yeah, she's been very proud. She, in fact, did her science project this year in her school. She's in first grade.
Okay.
And she did her school project on teeth this year. And she was really proud of it. And she's been excited about the mobile unit and wants to be a part of it. But yeah, she's done a whole project and hope she follows the path, but we'll see where she goes. But it's been starting early.
Yeah, that's great. I'll also share that Coppola, the team, brought out the dental van to the lab school where my son goes for kindergarten, and they're all excited about the dental van too. And one of the things we're hoping to do is arrange visits to more and more schools all around the South Side. We figure it's a great way to get kids started early.
Yeah.
And also for them to tell their parents and tell their grandparents, because, you know, we're trying to find people for the study. So it's a great way to do all those things.
I love it. Now, what does the dental van look like?
Oh,
I mean, is it like a SUV?
Oh, it's really a bus.
Is it an Escalade?
Yeah, you can really think of it as a CTA
It's
bus.
not a van, it's a truck.
It's a truck.
It's
It's like 37, 40 feet long, something like that.
This is like,
oh yeah, no, it's big.
Yeah.
It has full 2 dental rooms in it, like you would go in it.
And it opens up. It used to be someone's mobile home.
Okay.
And then they renovated it.
Yeah.
But it's got like this middle section that like pulls out into the street. So I don't know what, it's maybe like 12 feet, 14 feet wide when it's all opened up.
Yeah.
So it's big.
And you keep it on campus?
Oh, parking. We're still looking for really good indoor parking. If anyone knows where to park a 40-foot truck on the south side of Chicago, that's really important to us. We're having a little bit of a problem because in the winter, we have to keep it warm enough so the plumbing doesn't freeze.
Yeah.
So right now we've got it in the hospital parking garage. It's like working for now. We're not sure we're going to be able to keep it there forever because they need it for a bunch of deliveries and things like that.
Yeah.
So we are looking for parking on the south side of Chicago that's indoors.
So
or the south suburbs. So help.
Listeners, if you know of indoor parking for a 40-foot dental van, please call in 773-591-1690. But we have another caller. Alan, are you there?
Yes, hello.
What's up, Alan? Thanks for calling in.
Alice, I'm a senior citizen in need of dental care. I have dentures. I don't have a history of dental care, but I try to take care of my teeth. Now, I don't have gingivitis and all those things you were describing. I just don't have a lot of teeth. But I do have this bridge, and some of my teeth are the cavities. It's not a cavity, but the enamel's wearing. And I didn't want to go to just any dentist. I've been to at least probably 5 dentists. I was a person that was afraid of dental care.
Mm-hmm.
But since I started going back, I'm not afraid of it, but I don't think I'm going to the proper places to get it because I think I need something more. And I was happy to see the University of Chicago has something. But does that mobile unit allow for seniors to come? And does that mobile unit lead you to something more substantial, like hospital dental care or something with the University of Chicago? I have Advantage Medicare, and I'm seeking some kind of professional help so that I can be comfortable where I go.
Okay. So Alan has a question of one, he has Medicare Advantage. So would that qualify him? He's also a senior, so it sounds like he would be qualified. But he has had dental, issues in the past and has seen dentists, but he's not sure he's getting the best quality care from the dentists who are taking care of him. Is that correct, sir?
Yes, I have a very lovely voice, but I'm a female.
Oh, so I'm sorry. It says Alan on here. My sincerest apologies.
It's been my whole life. Don't worry about it.
Yeah, well, it was the name that really threw me off, if anything.
Okay.
But I wholeheartedly apologize.
Okay, yeah, I'm fine with it.
So, for how does one get connected with our clinic? I think it would be nice to just give out the contact info or the process of getting connected, so our caller can come in and and get a second opinion?
The simplest next step for someone who wants to see if they qualify for the program would be calling at 773-702-8617. So that's our phone number. I repeat, 773-702-8617. I think that's the best way to reach us. And if we don't answer, we will call you back. Leave a voicemail and with your name and phone number, and we will call you back. So that's the best way to reach us. And we can help you, guide you on if you qualify for the program. And like I said before, if you don't qualify for the program, we can also help you with dental resource guides of where you can go. And if you're looking for other facilities and clinics, we can
because I think that was part of the question. Like, if you see something maybe requires advanced care, is there some sort of referral process for them to actually get those services or meet those needs?
Yeah, there may be things that we don't do in our clinic, like implants or other things like that, but we at least can give people advice about where to go to get that, right? So the things that we don't do ourselves. And then I think part of the question too is about different types of insurance, and they can get complicated. So that's, I think, one of the reasons to call and talk it through. Yeah. There are some forms of Medicare Advantage plans that include dental, and there are others that don't. And then, of course, people's insurance are always changing. You know, so those are important conversations. And we try to talk people through that. There are certain legal limitations about advising people on insurance. We don't cross those boundaries, but we do try to help. The other thing I just want to say briefly is we know there's a lot of insurance changes that are coming in the next couple of months for a lot of people. And, you know, we don't have solutions for all those things in this study right now, but we are working on them. And we're also very open to partnerships with other healthcare organizations that, you know, are able to care for people, but in medical ways, but not in dental ways. So, you know, we're always open to talk, and we're really trying to ultimately find a way to meet the needs people have and learn in ways that give us these longer term answers to sort of move policy decisions.
I love it. So what do you think the response has been, you know, from our patients and the university? How's everybody responding to the mobile unit?
I think it's been positive. It's been great. We've been well received, and at Hyde Park, we've been working, like David said, for the last 5 years and just going to other sites. It's just been positive. It's just been so rewarding and just so welcoming, I will say. Like, it's never been where we've had any pushback or anything. It's just been like, if we can help the community, help patients, that's been a big part of it. And that keeps us going. That's been our biggest motivation to bring this and bring dental care on wheels, really, is where we see the need, but even being able to help and answer those needs, address some of those needs, I think it's been meaningful and it's been positive.
Yeah, sounds like it. Have you engaged in any kind of research with people outside of your program at our institution as far as collaboration?
Absolutely. So we're working with folks who study the microbiome. So there's a whole microbiome institute, and that's an important part of what we're doing. We are doing modeling to understand how the short-term effects on health could affect the longer-term outcomes. And we're doing this work in education. We're also working with folks at Midwestern University in the South Suburbs to educate their dental students about how to do research like this. So those are some of the things that we're doing, and we're hoping for more, including connecting this out to the work we're doing to try to expand primary care access. And actually offer more people primary care, and then link the oral care to the primary care.
Yeah, I feel like us on the nutrition side, we'd be interested in maybe doing a study where we could link poor oral health with increased risk of line infection.
Oh yeah, I think that would be great. I think this is really important. And let me just emphasize, like, doing really good, rigorous research is really important for changing decisions. One of the hard things about this study for us is we're trying to generate strong evidence that proves oral health makes a difference. So one of the things we do is it's a randomized trial. So when people sign up, you know, and they're agreed to be in the study, a fraction of them are going to get the free care. Another fraction won't get offered the free care, but they will at least get a rebate.
Yeah.
And so it's hard because we would like everyone who joins the study to get the free care in some sense.
Yeah.
But if we don't do the randomization, then we have the problem that we never know whether the care made a difference. We're never able to change policy. And we're left, 50 years from now with the same problems we got now with people not having access.
Yeah.
So I really hope we'll be able to make a difference. I'll just share this past week, I was at a meeting in Washington of a group called the Santa Fe Group.
Okay.
Which for 30 years has been trying to make the case that we need to do a better job of getting more people access. And that group is, I think, really trying to support work like this that really, advances the evidence base and ultimately informs better policy decisions.
That sounds amazing. So, I mean, it sounds like the overall goal, if we can use the positive results of this study, we can use that to argue for increased access to dental care for everybody.
Yeah. And again, it's a study. Maybe we'll discover it doesn't work, but I don't think that's going to be the case.
Yeah.
I think we're going to discover that oral health is really important for lots and lots of parts of people's health and lives.
Now, have you, a question I have as gastroenterologist, and I want to know if this is something that you've come across. I see a lot of patients who have difficulty swallowing. Okay. So listeners, the medical term for difficulty swallowing is called dysphagia. But it's really a sensation where food is actually getting stuck in the esophagus. And I've seen people have $1 million workups all over the place. Everyone's looking for an esophagus problem. Then they come to see me and we start having a conversation. I ask about teeth. A lot of times, some of those patients may not even have teeth. And it's not that they have a problem with their esophagus. It's that they can't chew their food, and unchewed food has a higher likelihood of getting stuck. Have you come across similar issues?
In fact, recently we were talking to somebody a few weeks ago at swallowing and studying the oral health connections of it. Of course, we hear that and we see that it's a lot about chewing. We see more of chewing and chewing ability because of functional teeth that we call in dentistry about when two teeth come in contact with each other and you can chew. If you don't have your opposing tooth, you can't chew properly.
Yeah.
So we see that, but that has its impact on swallowing and just like David said early on about liquid diets, and people tend to shift to different types of food to avoid getting to swallowing and those kinds of issues. It's easy to kind of change your food dietary habits and things like that. So
and I mean liquid diets for some people maybe there's no choice, but for most it's not preferred to being able to really chew your food. It when you have whole foods, it takes longer to break down in your body. It spreads out the sugar over a longer period of time. You're less likely to have problems with diabetes and uncontrolled blood sugar.
Yeah.
So again, like as we were talking just at the very beginning, the teeth are critical to making the whole body work right.
I love that. Now, we had another caller. There was a caller, Avish. So Avish, if you want to call back, we will definitely take your call. 773-591-1690. So with the mobile dental, so Avish, are you there?
Hello.
Hello.
Yeah. Hello. Are you speaking to me?
Yep.
Okay. My name is Wally Turner, and I have a question, but I would need to get your phone number because I had all of my teeth extracted and my jaw don't line up with the top, and I've got 3 sets of dentures and none of them work. Can I get your phone number?
Yeah. What's the number to the clinic again?
773-702-8617. That's our general study line, and we can see if we connect you to the dental clinic, but one of our team members can talk to you.
Okay. 773-702-8617.
Correct.
Okay, and I thank you.
Thank you.
Thank you.
Thanks for calling, and we appreciate that. So where do you see this work going for the future? I mean, do you envision building a clinic at University of Chicago?
Yeah. Well, so we already have a clinic in some sense, although it's frankly a clinic for this research study.
Yeah.
I would love it if the U of C built up more general dental clinics, and I think for some of our patients where the medical issues are particularly severe, that may be especially important if we do more of it. As from hearing about the clinic, the mobile clinic, we're hoping to get it out to more and more places around the south suburbs where some of the remote U of C sites are. We're also trying to bring it to senior buildings for the reasons I mentioned earlier. And I think that's really important. My hope is that this study that we're doing here will eventually expand to other places all around the country and get bigger and get data even faster. But I also hope that it will expand to not just include studying the effect of the dental care, but studying the effect of integrating dental care with general medical care. And one of the things we're excited about is the idea that we have a dental van. We also now have a primary care van where we can take out a unit to give people primary care closer to where they live. And we're trying to gear up to take that out to senior buildings, for example, around the South Side. And one of the interesting things we're thinking, okay, we'll take these two vans out together.
Okay.
But one of the things we're also realizing is that the dental van can also provide primary care, and the primary care van can also provide dental care. So we're, there are, for example, dental chairs and things like that you can fold up, you put underneath the primary care van.
Wow.
So the real vision here is to get integrated dental care and primary care coming right to the places where people live. My parents are both older at this point, and it gets harder and harder to get out of the house and go do things. And I know that's true about many, many people.
Yeah.
And I think the more we can bring care to the folks who really can't just come and get it, the better we're going to do in preventing illness. And, even when illness exists, getting on top of it before it's serious. And that's going to make people healthier. It's going to keep them out of the hospital. It's going to save money. It feels like something we should be doing. And just as we're trying to prove that good dental care and oral care makes the difference, we think it does. We'd really like to prove that giving people better access to this integrated dental care and medical care close to where they live really makes a difference. So that's I think the big vision.
The big vision. I mean, that sounds phenomenal. Now, we do have time for one more caller before we're going to close out. So, caller, are you there? Hello.
Hello, can you hear me?
Yes, we can hear you. Thanks for calling.
Okay, thank you so much. So I have a question. I have boys which are in elementary and teenage, and the kind of meals in school, they get like a 20-minute break for lunch. They're always in a rush. They are eating super fast, eating junk food all the time. Anything that you can recommend for kids of that age to improve on their oral health, really?
We both have kids of that age. I wish we had the magic solution. Less sugar, more brushing, teaching them about oral health as best you can. I don't know. Copal, have you solved this one?
Yeah. Is there any truth to the statement, apple a day keeps the dentist away? Like, is that a thing? Or eating popcorn?
Yeah, there's so much. But I think the biggest part, just keeping what they're eating, keeping it, and the connection between oral health and other parts. I think just that education, oral health education at that age is really important in understanding the long-term effects of things. I think we think of it as a small part of your overall health, but that education piece is really important of how it's impacting everything else, not just your diet, not just we talk about everything else, just talking about food habits, how diabetes in later stages of life and things like that, how that can has long-term impact on it. I think that's important. So chewing, number of times you chew your food, I think like the caller mentioned about quickly eating your food, I think it's important to chew and enjoy your food. I think the big part of what I tell my girls is enjoy your food while you're eating it. Sometimes it's hard, I know, but I think that makes a lot of difference in talking to them about what you're eating and what it does.
All right. So we have about a minute left. I want to give each of you the opportunity to kind of close the show out with one more thought. So Maybe can you share the number again? I know you shared it a couple of times, but I want to make sure the listeners know how to get in contact with the clinic.
Absolutely. It's 773-702-8617. I repeat, 773-702-8617.
And any final thoughts for our listeners?
My final thoughts are really to encourage everyone to take care of their oral health. If they're interested in the program, reaching out to us, encouraging your family, peers, like David said about school. It's not just about people 50 and older, but like kids and everyone. We really believe in what we're doing and really think like oral health can make a difference. So yeah, I think just keeping an eye out for your oral health.
Sounds good. So we got about 30 seconds. Final thought from you.
I think Copal said it beautifully. I'll just say, how grateful I am to be able to be here and talk about this, and just to ask your listeners that if they can think of people or organizations who we should be talking to help spread the word and get them involved, please reach out and connect us to them, and we'd be happy to just keep passing on the information and seeing how many people we can engage and help.
Well, appreciate you both for coming on. Listeners, please tune in next week to the Community Health Focus Hour. And that is our show. Thank you.